So the vertical integration that you see within the supply chain on the insurance side is that PBMs and health plans have now combined. And they've actually made investments downstream into distribution channels, such as specialty pharmacies, specialty distributors, and infusion houses. So that creates an imbalance for those hospital systems that want to create their own ability to manage patients within their system, offering their own solution, such as a specialty pharmacy. When the payer competes with the provider, that doesn't create a fair system. So the vertical integration, while it can create some consistencies, it also creates an imbalance in the leverage of competition within the supply chain. Manufacturers are actually going to have to contend with a lot of the supply chain challenges with the vertical integration by trying to determine how they can and should be distributing their products. As we get more towards rare and orphan disease state products, you're really talking about 1, 2, 10, several dozens of patients. So that's going to require quite a bit of creativity. And in many cases, it may actually require a direct agreement with a hospital system that circumvents one of the other supply chain participants, such as a payer-owned specialty pharmacy or infusion house. That hasn't quite come to the fore yet, but it is coming, especially with the advent of more and more of these specialty cell and gene therapy medications coming. There's a lot of very, very well-intentioned systems to try to create their own vertical integration where there's quite a bit of communication among specialists, general practitioners, and pharmacy, but they're not all created equal. The best case scenario is that hospital systems creating their own supply chain play have constant and regular communication with their providers so that the consistency of care, the quality of care to the patient is ensured. That's really where the big box supply chain participants tend to have their advantage. So if a hospital system is going to get into that space, communication is going to be key across their system.